question is, do we offer liposuction to the knees? So, I mean, you can do liposuction to any part of the body. So, and we do liposuction. So on those grounds, then you could say, yes, we do liposuction to the knees because it is a part of the body. But it's not common, and it is, so I think if someone specifically wants, the ankles is the other one. I'm going to throw in ankles as well, knees and ankles. We do get people asking for it, and personally, I usually don't do it because I find it difficult. It's quite subtle, the to reshape the knee and the ankle. I find it quite hard to do, and unless there's some significant deposition of fat in the area, then I am concerned about. Problem with liposuction is the risks are over or under correction. You do too much or you do too little, and so there's not a huge amount of fat around the knee, and if you do have a significant amount of fat around the knee, you're probably overweight. And I don't, it's not good to do liposuction on people who are overweight, because you should lose weight first. Liposuction is really for people who've lost weight, who've got resistant areas. And it's unusual to see a significant deposition of fat around the knee, certainly to the extent that I would consider doing liposuction. So I guess the sort of reflex answer with that would be no. If someone sort of reflexly says, do you do liposuction to the knees, I would kind of say no. However, if you could always send us a photo and we could have have a look at it. But it's not certainly a thing that I would commonly do a liposuction to the knees. And again, if there is a significant deposition of fat around the knee, it might be that there's extra skin as well. So you've got to think about, do you do an excisional procedure rather than a liposuction? Because liposuction doesn't remove any skin, and so there's a risk that there can be hanging skin. So it's not a common one. So never say never, but I never do it. No, I rarely do it. So it's and it's like any of these things, send us a photo and we'll have a look, but don't hold your breath. I think some people do. I think maybe it's probably more suited to people who do the assisted forms of liposuction, your vasers and your things like that, because I think they do report to give some skin retraction and stuff, so they might be more amenable to it. I think some people do a lot more, some people do kind of a lot of liposuction. I know there's some doctors who that's all they do. I can't imagine how you could build a practice on liposuction. I mainly do it in conjunction with tummy tucks. That's my main use of liposuction personally. So, to the hips, the flanks, the sides, also gynecoplasty, male breast tissue. So, do we do liposuction to these? Not very often. So, no, not really.